Imagine being told to lie completely still, while a giant machine slowly pulls you into a glowing tunnel. The room is cold, the scanner is huge, and then suddenly, it starts making a loud knocking sound, like someone is building a house around your head. But here is the strange part. The machine is not taking a normal picture of you. There is no camera inside the tunnel, and unlike an X-ray, it is not using a beam to pass through your body. So, how does this machine see your brain, your spine, your joints, your organs, and tiny injuries hidden deep inside you? The answer is almost unbelievable. It makes your body talk back. Your body is full of water, and inside that water are tiny hydrogen particles. They are in your brain, your muscles, your organs, your blood. Normally, they are messy and random. Imagine a crowded stadium at night. Thousands of people are standing everywhere, facing different directions, making random noise. That is what these tiny particles are like before the MRI begins. But the MRI scanner is basically a giant magnet, and when your body enters that magnetic field, many of those tiny particles start lining up. It is like the crowd suddenly turning to face the same direction. Now the machine has their attention. Attention is not enough. To make your body answer, the scanner sends in a radio wave. Think of it like someone clapping loudly in that stadium. For a moment, the crowd reacts. The tiny particles inside your body are pushed out of position. Then, the radio wave stops. And as the particles settle back down, they release tiny signals. That is the body talking. The MRI scanner listens to those signals. Then, a computer turns them into images. So, an MRI is not really seeing you like a camera. It is listening to how your body responds after being disturbed by a magnet and radio waves. That is why this machine is so powerful. It does not need to cut you open. It makes the water and fat inside your body send back clues. Once the signals return, the scanner faces a much harder problem. Your entire body is talking at once. Your brain is sending signals. Your muscles are sending signals. Your blood, fat, fluid, joints, and organs are all sending signals at the same time. That is like standing outside a stadium and hearing thousands of people shout at once. You know people are talking, but who said what? And where did each voice come from? This is where the MRI becomes brilliant. Inside the scanner are special coils that slightly change the magnetic field in different directions. These changes help the machine figure out where each signal came from. It is like giving every voice in the stadium its own location. Now the scanner is not just listening, it is mapping. That is why the final MRI image can appear as slices. A slice of the brain, a slice of the spine, a slice of an organ. The loud knocking sound is not a warning. It is not the machine breaking. It is part of the scanner building the image. Those magnetic field changes happen very quickly. The coils vibrate, the machine knocks, and the patient hears that intense hammering sound. In a strange way, the noise is the sound of the MRI drawing. Every knock is part of the machine asking, where did that signal come from? Where should this piece go? How do we build the image? That is why patients wear ear protection. MRI is loud by design. An MRI image is not one instant photo. It is built from many tiny signals collected over time. That is why the technologist tells you, do not move, stay still, hold your breath for a moment, keep your head in place. It can feel annoying, but there is a reason. If you move, the map shifts. Imagine trying to make a puzzle while someone keeps moving the table. The pieces no longer line up. That is what happens when the body moves during the scan. A small head turn can blur a brain image. A knee twitch can ruin a knee scan. Even breathing can matter for some body scans. Staying still helps the machine keep the body's signals organized long enough to build a clear picture. MRI can make the same body part tell different stories. One setting can make fluid stand out. Another can make fat easier to see. Another can help show swelling, injury, or abnormal tissue. So MRI is not just one type of picture. It is more like asking the body different questions. Show me the fluid. Show me the soft tissue. Show me the injury. Show me the blood vessels. Sometimes doctors also use contrast to make certain tissues or blood vessels stand out more clearly. That is why MRI is so useful for soft parts of the body. The brain, the spinal cord, ligaments, muscles, organs, discs in the spine. Things that do not always show clearly on a simple X-ray. The most serious part of an MRI room is invisible. It is the magnetic field. Metal objects can be pulled toward the scanner with terrifying force. Keys, phones, tools, some medical equipment. Even objects that seem harmless outside the room can become dangerous near the magnet. That is why MRI safety screening is so strict. Patients are asked about implants, pacemakers, metal fragments, clips, devices, surgeries, and anything that might react to the magnetic field. Many modern implants are safe under the right conditions, but the staff must know first, because inside an MRI room, metal is not just metal. It can move, it can heat, it can distort the image, or it can interfere with medical devices. So the MRI scanner is not a camera. First, the magnet lines up tiny particles inside you. Then radio waves disturb them. Then your body sends back signals. Then the scanner locates those signals. Then the computer builds them into slices. And finally, those slices become an image a doctor can read. The machine is not just looking, it is asking. Your body is answering. And for a few minutes, a giant magnet makes your body talk. And that is why the MRI scanner is one of the machines that keep us alive.